Good Monday morning and welcome to the Oakland County Megacast, the first Megacast of the month of February 2021. I'm Tyler Kieft in the studios of our flagship station, 89.3 Lakes FM and Civic Center TV. In addition, today, as always, we are on 88.1 WBFH, the Biff, as well as Birmingham Area Municipal Access. It makes up our network of stations each and every day here on the Oakland County Megacast. And as always, you can find us online as well. We webcast the show live on a different Facebook page from around the Oakland County community each and every day. Today, that Facebook partner is our good friends over at the West Bloomfield School District. We will be speaking later on with their Assistant Superintendent for Curriculum, Assessment, and Instruction, Deanna Barash, as they begin today, in this month of February, this first day of February, they begin their hybrid K-12 in-person learning system. And that is beginning today. We'll get a little overview of what that is, how that's going to look. I'm sure it'll have some similarities to what other school districts in our area are doing, and we'll get more information on that as well. Great lineup of people today on the program. I will be joined by Ronnie Dahl in just a few minutes. As we have learned throughout this pandemic, with technology being such a key part of our daily lives, when things go wrong technologically, we just got to kind of pick it up and keep moving along. So I do see Ronnie now. We'll get to her in just a minute here, make sure that her connection is back up. You know, routers go out, connections go down, cameras stop working, microphones malfunction. It happens to all of us, and we roll right on through. So we do have Ronnie here with us. Let's go ahead and see how she's doing. Good morning, Ronnie. What a way to start your February, huh?
And a Monday to boot.
I know, even better.
But you know, this stuff happens. I mean, imagine if you're a teacher, how often that happens to some of the teachers. I know we had Professor Doolio on once, and his router went out just before his appearance as well. So it happens, but we're able to get it rebooted right now. So fingers crossed it stays this way for a little bit.
Yeah, hopefully that bug doesn't spread across Greater West Bloomfield over to us, or we'll have no show. So, we'll take that as a W for now, and hope that things stay consistent throughout the rest of our show. And then, at 12 noon, the internet can go out all throughout the world. So.
Exactly. Well, we've had it go down on us before, sure. Tyler, when we were both in the studio.
Yes, we have. That's good times.
So, it's the world we live in now. And I will say, I don't think the world's going to change much as we go forward as well, because I think Zoom and how so many companies are operating, that's going to be sticking around for quite some time. I think even post-pandemic as well.
Yeah, I think so also. Because these companies and really the entire world have seen how much more efficiently we can do things like meetings and conversations and planning of different things without having to travel to one another, without having to necessarily clump a bunch of people into one single room. People can work from home if they're not feeling well and they don't absolutely have to be in the office. I think we've learned a lot about how we can use these digital and technological means that we have come to learn over this pandemic to our advantage going forward. So I think that we're going to see a lot of this continue on after the pandemic.
So with that, hey, Tyler, I was a little disappointed watching the news this morning all across the country, like New Jersey, New York. They are in the middle of the craziest snowstorm, and all we got were a couple inches yesterday. I wanted a lot of snow.
Yeah, I was really thinking we were going to get absolutely destroyed yesterday, and then we ended up just getting a couple inches. I walked out in the morning, I'm like, all right, well, we're supposed to get a ton of snow overnight. I went to bed at an ungodly late hour on Saturday evening into Sunday morning and checked the weather before that and saw just a big line of snow coming all across the radar all throughout the morning and into the early afternoon, and thought, okay, well, we're going to just get blasted with snow. I should get up in the morning and go shovel off my balcony so I don't have a bunch of icicles crossing down over the neighbor below me, and I go out there and it's like half an inch of snow on there. And I go off and brush my car off, and then it's like, well, this is incredibly underwhelming. I'm fine with it. Don't get me wrong. I'd rather have that than have 10, 12 inches of snow out there and everybody trying to figure out what is life. But still, very, very underwhelming considering we were expected to have this snowstorm from hell.
I will say, but if we're going to have this freezing cold weather that we're going through right now, and it's expected to stick around all week, then I want some pretty new snow to go with it.
Yeah, we might as well be entirely miserable, right?
No, it's nice to look at.
Yeah, it's nice to look at for like 10, 10, 15 seconds, maybe a couple of minutes at the most. But then you're having to deal with it, and even worse, deal with other people dealing with it, which is arguably the worst part of winter altogether.
I got you there. I will say, but it was a good weekend. But you know who did not have a good weekend, I would imagine? The IT team over at Beaumont Health. Did you hear this story? Beaumont Health is canceling hundreds of COVID-19 vaccination appointments because they were scheduled without authorization after a user found a vulnerability in its scheduling tool. And so they found the problem in the hospital's Epic medical record system and shared the scheduling pathway publicly. So about 2,700 people were able to cut in line and sign up for vaccine appointments, according to a release from the hospital. But the hospital detected the unusual activity, members of its IT team, Saturday. And so now they have gone in and canceled all of those appointments. Now, they do say no medical records were compromised, and those who scheduled the appointment using the alternative pathway will be notified that their appointment has been canceled. The others that had their appointments through the right way, those appointments will stand.
Well, it's good that they're going to maintain those appointments for those that scheduled them the right way, and then everybody else is going to get notified that they will not get their appointments under the no cuts, no butts, no coconuts clause of 2021, because they should know better. I mean, you're cheating to get in line for a vaccine that's being very orderly, in a very orderly fashion, being arranged to be distributed to the public. You think you're going to get away with that? No. And these hospital systems have very large IT apparatus and teams in place that when something like this happens, they're going to figure it out. So nice try, but get in the back of the line. Larry isn't up front there. That's a reference to another show where someone cuts a line yelling Larry.
I will. We've said it before. IT people, they really are coming out the superheroes during this pandemic. For me, my IT person is my husband. He's always able to help get us back online. We're all learning a lot, right?
It's true.
Hey, all those MSU students, Tyler. They now are being told to basically shelter in place due to a COVID surge. So with COVID-19 spreading through residence halls and test positivity rates triple the state average, Michigan State University is asking students stay in their dorms or their apartments. So the enhanced physical distance directive sent in a letter to students Saturday will be in effect through the 13th of this month. Keep in mind, the University of Michigan announced a similar directive last week. That one for U of M students is set to expire on the 11th of this month. No cases of COVID-19 variants, some of which are believed to be more contagious, have been detected yet at Michigan State University, although there have been 14 variant cases identified at the University of Michigan. But now that order being felt at two of our largest universities here in the state of Michigan.
Yeah, and I think this is something that we're going to see become more common across the state as we get further into this pandemic with the variants at play. Of course, as the article said, and as you just said, there's no cases of the variant yet that have been identified in East Lansing on the campus of Michigan State. It has, however, been identified at the University of Michigan, which is in an area in Washtenaw County in the greater area that has seen several cases of the COVID-19 variant. So it hasn't quite made its way into Ingham County and into the Michigan State University general area. But we've seen them do this a few times before where people are in too close a proximity with one another. They're not entirely following those guidelines that are in place to help prevent the spread of COVID-19. It's tough to do on a college campus when you got thousands upon thousands of people each and every day congregating with one another. So having to be told to stay in place, don't go to physical places in person on campus and do your classes from your apartment or from your dorm room. It's not entirely all that surprising. That being said, I had my first semester up there at MSU in the middle of a really bad winter. So, if they're getting anywhere near the kind of snow that we're used to getting at this time of the year, I take that as a very small victory, albeit in not so great circumstances. And it does appear we have once again lost Ronnie. We'll stick around here and continue to go through our headlines. Next up on our list, Michigan releases COVID-19 Safer Dining Plan. They released the COVID-19 Safer Dining Plan, which includes a voluntary program that allows restaurants to work with licensed HVAC contractors to improve air ventilation. Governor Gretchen Whitmer announced restaurants can reopen beginning today, February 1st, with safety measures in place, including 25% total indoor capacity limits, mask wearing when not eating or drinking, 6 feet between tables, and no more than 6 people at a table, as well as something we've seen in many other states, a 10 p.m. curfew at these restaurants. The Michigan Occupational Safety and Health Administration, or MIOSHA, also launched a new site dedicated to COVID-19 workplace safety on Friday, complete with fact sheets, reopening checklists, and coronavirus safety posters for employees. Through MIOSHA, the governor proposed funding to support the program as part of the $10 million budget plan for COVID-19 safety. You have a link to both the COVID-19 Safer Dining Plan and to MIOSHA's new website dedicated to COVID-19 workplace safety that was launched on Friday on our news and headlines site, civiccentertv.com/coronavirus. You can take a look at both of those in full detail. We have hyperlinks in the articles that take you to each one of those places, so you don't have to do a bunch of jumping through hoops trying to find it in Google or on the websites themselves. That's all at civiccentertv.com/coronavirus as we continue to bring you the top news and headlines about COVID-19 and other top stories in our local area each and every day. Michigan is getting better at vaccine distribution. It's just still not good enough. After a slow start, Michigan has ramped up its coronavirus vaccinations and is now one of the better states at getting shots into arms. Michigan now ranks 20th in the rate at which it's vaccinating its residents, up from 45th just weeks ago. But despite the improvement, frustration is rampant among residents as well as counties and health officials. Most say there are simply not enough doses of the vaccines designated to stop the spread of a disease that has killed over 14,000 people in Michigan alone. So far, vaccine manufacturers have shipped nearly 1.5 million doses of the vaccine to Michigan, and over 802,000 have been administered to residents. 659,000 first doses, 143,000 of those already getting the required second dose and completing the full process of vaccination with Moderna and Pfizer vaccines. One other source of frustration is that some counties appear to be doing better than others at vaccinating residents. Statewide, about 6,500 out of each 100,000 residents have gotten at least the first dose of the 2-dose vaccines. The Biden administration on Tuesday last week announced that states can expect a 16% increase in doses beginning the next week over, or this particular week. For Michigan, that would mean another 30,000 to 40,000 doses of the COVID-19 vaccine. County health officials say they need far more. So vaccination is continuing to be a bit of an issue here in the state of Michigan and across the union, as there are enough vaccines out there. There's allegedly been enough vaccines out there, and the distribution was just poor under the previous administration. Now we're in this new administration, and there seems to be more of a plan in place for a national strategy, as there was allegedly no national strategy in the previous administration, but still a little bit slow getting these distributed, getting them out to counties, arranging an orderly fashion in which to get shots in the arms. And there's also that extra wrinkle of having to get 2 shots per person to be fully vaccinated. Of course, there is a Johnson & Johnson vaccine that is still currently in the works. It's expected it could be approved in the next few weeks, and that is a single-shot vaccine that doesn't require as much It doesn't require special refrigeration and new equipment for local county health officials and hospitals in order to obtain, receive, and properly store each of those vaccines. So that's all of our headlines for today. CivicCenterTV.com/coronavirus. In addition to all of our headlines each and every day here on the Oakland County Megacast, you can find resources about COVID-19 as this information continues to be updated daily, weekly, monthly. There seems to be something new about COVID that we learn every single day. You can learn that information online, CivicCenterTV.com/coronavirus, from resources nationally from the Centers for Disease Control and Prevention, from the state of Michigan, as well as Oakland County, and coronavirus-specific information to your hometown, whether you're in West Bloomfield Township, Rochester Hills, who will speak to their fire department later on today, Bloomfield Hills, Orchard Lake Village. We've got a bunch of those cities and townships and villages and their go-to information about COVID-19 directly from their websites on our website at CivicCenterTV.com/coronavirus. In addition, we got a lot going on today on the Oakland County Megacast. If you miss any of it and you want to watch the full episode later on, start off from where you left off. If you need to leave us at some point during our 2-hour run today, you can go to CivicCenterTV.com/megacast and watch full episodes. Hey, if you don't have a whole lot of time, there are a couple interviews that you find very interesting and want to at least get some information from them, maybe the most important point from each one of these interviews, and get a quick bite of every single conversation that we have today on the show. You can watch our short clips, or if there's only a couple interviews that really interest you from our show today, you can find those in their entirety on CivicCenterTV.com/megacast by clicking on our Watch Full Interviews link. We're going to take a quick break and we'll kick off the show today. A lot of great guests to speak to in just a few minutes. We'll kick off the show speaking with the Rose Hill Center. They provide long-term mental health care as well as comprehensive psychiatric treatments. We'll speak with Kevin Corcoran from Oakland University, the Dean of their College of Arts and Sciences and their Chief Community Engagement Officer, talking about the new Barry M. Klein Center for Culture and Globalization. In the 11 o'clock hour, we'll speak with John Lyman from the Rochester Hills Fire Department, Deanna Barash from the West Bloomfield School District, and we'll finish off the show today with a musician. Drummer B joins the show, just performed The Age of Aquarius at the Belle Isle Aquarium, and we'll speak to the Drummer B about that performance and life as a musician during the COVID-19 pandemic. That and more coming up. You're watching and listening to the Oakland County Megacast on 89.3 Lakes FM and live streaming online, lakesfm.com, 88.1 FM The Biff, and Birmingham Area Municipal Access.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask.
Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together.
Together.
Together. For the latest information, visit oakgov.com/COVID.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our Test Locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe in our studios, Civic Center TV, and 89.3 Lakes FM. We're also on Birmingham Area Municipal Access, 88.1 WBFH, the BIF, as well as on the Facebook page of the West Bloomfield School District on today's edition of the Oakland County Megacast, the first Megacast of February 2021. Apologize for a little bit of the extended break we took there as we try to work out some technological issues. Ronnie Dahl will rejoin us in just a few minutes. But we got a lot to get to on today's show. We're going to get right into it, regardless of any technological issues. During this pandemic, one thing that has become greater on the forefront and had, for good reasons, had the stigma reduced significantly has been mental health. People have been struggling because of the pandemic, or their struggles have been amplified by the pandemic. And there are lots of great organizations in the Oakland County area that are helping to support those who are struggling with their mental health or working to improve their mental health. And one of those organizations is the Rose Hills Center. And we're now pleased to be joined by Rochelle Rothwell, the president and CEO of the Rose Hills Center, as well as Laura Mueller, the admissions director at the Rose Hills Center as well. Ladies, thank you for joining us today on the Oakland County Megacast.
Thank you for having us. Thank you very much.
Appreciate having you on. So, Rochelle, for those who are not familiar, what is the Rose Hills Center? What services does the center provide to those in our community?
Well, Rose Hills Center is a residential rehab center servicing those with serious mental illness. And we have a variety of programs, our residential program being our primary program, but we have an extended program, transitional living program. We support those that go on to live independently in the community. So it is a wide-ranging program.
So for those that may need your services, how do people qualify for them, or what does your organization need to know about those that may need your services or to be able to qualify to receive services at the Rose Hill Center?
Yeah, we work with adults, and primary diagnoses that we work with would be adults diagnosed with schizophrenia, schizoaffective disorder, bipolar, major depression, and we also do a lot of work with individuals who have been diagnosed with borderline personality disorder and some other personality disorders. And what we find is that sometimes a mental illness becomes so severe that you're not able to manage it without the help of a community. And that's where Rose Hill comes in, is for people who have tried other mental health treatment, such as outpatient, intensive outpatient. A lot of the times, people that I work with have had multiple psychiatric hospitalizations, which is an acute short-term treatment model, and really need long-term treatment. And that's where Rose Hill comes in. Rochelle mentioned the different programs that we have. And that's our program is designed to help residents stabilize, but really manage and find meaning in their life to rehabilitate. And so as far as someone that's looking at services, typically they've, like I've said, have tried many different treatment programs or treatment modalities and realize that they need more intensive treatment, and that's where we become involved. And so we work with people really all over the country to come to our treatment program and to stay with us, like I said, to really manage the illness and find meaning and get to their, I guess, highest level of independence.
And so with that, you mentioned that it's not the same thing you'd get from acute psychiatric services or mental health services that are maybe just for an abbreviated period of time. This seems to be a lot more extensive and a lot more in depth. How long do people usually receive services from the Rose Hill Center? And what really sets that apart from acute services that may not be as effective long term for those who are battling with psychiatric ailments or mental health issues?
Yeah, so acute short term is typically between 3 days, 7 to 10 days, maybe an average stay. And that's for someone who is in crisis that needs immediate help. And the goal of that type of treatment model is to really start the treatment journey. And for some people after an inpatient hospital, outpatient isn't enough support or services, and that's where an intensive residential program comes in. It really depends on what's going on with the person and how much support they need. However, we do have a continuum of care where someone can come into our residential program and may stay between 6 to 9 months before graduating to a transitional living program where they're living in their own townhouse here on campus for potentially the first time, or since they began struggling with whatever mental health condition that they came with us to receive treatment. And so typically someone would stay minimally about 3 to 4 months with us for intensive treatment and may stay over a year depending on the type of treatment they need and their goals. I think that's a really important piece to think about when you're looking at mental health treatment, is that we all need to work on our mental health, and we may need just a tune-up with a therapist every week, every other week, once a month. But some people need much more intensive treatment where they're receiving therapy, case management, psychiatry, all in a community setting, and that progress takes time. Unfortunately, mental health isn't something that is managed in a short term, but like those short-term programs really set the foundation for long-term treatment, learning, stabilization, and mental change.
We're joined by Rochelle Rothwell and Laura Mueller from the Rose Hill Center joining us today on the Oakland County Megacast. And as you said, there's not any simple fix to any of these mental health issues that somebody may have, or to psychiatric issues that somebody may have. And so going into services like this, it's got to be individualized, person to person. How does the Rose Hill Center work with the patients, work with their previous medical providers, with the mental health service providers, in order to create programs that will be helpful to them long term and in the short term as well, because every single day is a different battle and a different part of the journey?
Oh, yeah. And I'd say it starts with that first call in admissions. And what I say Rose Hill is really where we are best is that we build a team. mental illness isolates someone so much from their loved ones. We work with people that have a mistrust of services based upon previous experiences. And so building a team where the individual receiving services is the leader and identifies their goals, and then the team, including our admissions department, case managers, therapists, our support staff, our activities department, our nurses, our dietitians, the family, past treatment providers, so that we're talking about what's worked and what hasn't worked, and really building a team of people to support someone, because we know that that's what someone needs, is to have trusted professionals that are working with them to meet their goals.
The added stresses of the pandemic, whether it be loss of work, whether it be social isolation, whether it just be the uncertainty of this pandemic now going on almost 11 months at this point, it certainly doesn't help the mental health crisis that we've already had established in our country long before the pandemic. And the pandemic can't be easy to navigate either for organizations like yours, who do have people coming in for 3-4 months at a time, reacclimating to the outside world, and then others coming in as well. So, Rochelle, how has the Rose Hill Center managed that during the pandemic, to be able to safely bring people in, provide them the services that they absolutely need, but in a safe manner for them and for their loved ones and other people in their life as well, as they exit back out into everyday life?
Well, I would say it's been incredibly challenging. I think it's been challenging for us as it's been for other organizations. And I always try to take the opportunity to sort of commend the staff that are here at Rose Hill, because it's taken a tremendous amount of creativity to meet the needs of the residents and really support each other. I mean, we're all having our own challenges navigating personally through the pandemic. So I think it's been a lot of creativity. There was a stretch of time that we paused and we did not admit folks as we were trying to make, adjustments to offices and, screening folks, just really keeping the whole campus on lockdown. We did have that pause, but we were able to figure out ways that we could admit folks safely and still manage to meet the needs of those folks that are on campus. Many of our residents, part of the program would be to volunteer and work in the greater community. And of course, in a congregate living setting, we've not been able to allow for that. So again, I speak to the staff and the creative ways that they've created programs on campus to allow folks to continue to progress through their journey and find, victories and progress in just really creative ways. Work programs that are on campus that are added to what we would normally do. A lot of fun activity programs, even just being able to have some entertainment where we can still be socially distant but be together. And I think that it's been a really bonding time, honestly, I think, for residents and for staff.
Rochelle, on that, how does that creativity and that ability to re-navigate the way that you provide treatment during the pandemic, how is that going to help provide even more effective services in the post-pandemic world? Because these problems don't go away when COVID-19 is gone.
Yeah, I think, I think it's probably our team that's bonding together and pulling together. I think that is a group that has found, like I said, these new and creative ways that they're meeting needs of residents. I think we've learned a great deal about new and, just different ways to support the needs of our residents, on campus. I think it also just the stigma. I think even for many of us working in a mental health facility, we might not always talk as easily about the stresses that we're facing. And I think that our group, again, like I say, we've bonded, we've opened to each other, we've found ways to support not only the residents, but also the staff. Many staff, are finding, situations with loved ones that have been sick or have died of COVID-19, maybe loss of work. I think, again, it's just made our community a stronger community of support for each other, and probably has helped us develop a lot more understanding of each other.
Just over the holiday season, the Rose Hill Center participated in the Detroit News' Cheer for Charity drive, and actually did very well, raising over $43,000 for this organization, and ended up winning $20,000 in a prize from the Detroit News for that competition. What led the organization to want to participate in this, and on top of that, how is the Rose Hill Center going to benefit from the prize money that was received from this effort?
Yeah, I think we were just as, we were so thrilled by the opportunity to be invited to participate, but I think we were also a bit blown away by the sheer amount of support that we received. I would say that Rose Hill has many, I think the work that we do speaks to many. So we've been really fortunate to have a lot of donors that have really stepped up to support Rose Hill throughout the years. And those funds actually are going to help to continue to enhance our programs. But a big part of why we have such a large and consistent donor base is simply that we do a good deal of charity care. So we offer scholarships to those who would not be able to afford the cost of Rose Hill or receive the services that they might need. And so, I think the opportunity for us to continue to be more known as a community in Southeast Michigan, and for the services that we provide, I think we are happy to get the word out there so that we can continue to raise and garner support for that financial assistance program.
We're joined by Rochelle Rothwell and Laura Mueller from the Rose Hill Center. Just another couple minutes with you before we'll say goodbye here on the Oakland County Megacast. Laura, for those who may themselves or a loved one or a friend may need the services of Rose Hill, or those that are seeking those services from Rose Hill but looking to potentially receive one of those scholarships that Rochelle just talked about, what do they need to do in order to begin the process of admitting themselves or their loved one to the Rose Hill Center?
Right. It's as simple as picking up the phone. Our admissions team is ready to answer any questions that you may have. And our goal is, and especially during the pandemic when there is such a great need, is that you will find our team is ready and open with kind ears to listen, and that we are one of the last phone calls that you will need to make. If it is Rose Hill or if it is something else, that we can provide some resources so that everyone is getting mental health treatment. If you wanted to learn, or anyone listening, learn about Rose Hill, our website, rosehillcenter.org, is a wonderful place to get some introductory information. We do have a YouTube channel as well that has tours of our campus, interviews with past residents and their families, so that everyone listening can experience what it is that we do, and the difference that we make.
Well, Laura, Rochelle, we thank you very much for joining us today. Anything else that you would like to say, or any other information that would be helpful for our audience or other people to know before we say goodbye?
I think recognizing the importance of mental health, it's something that we've known a long time about. COVID has made things worse for a lot of people, but I think it's also the opportunity to make things better, for us to all have the understanding that people that we're working with, we may not know some of the struggles that they have, but kindness, I think really goes quite a long way when you're working with someone, and that there is effective treatment, that this is not something that you need to suffer alone with. There are people that are ready to help, and this is something that is manageable just like any other condition.
It is a day-by-day process, that is for sure. Rochelle, Laura, thank you very much for being with us today.
Thanks for having us.
Thanks so much.
Appreciate it. Rochelle Rothwell and Laura Mueller joining us from the Rose Hill Center on the Oakland County Megacast. We'll take a quick break. We'll come back with more on our family of TV and radio stations. Next up, we'll have the Dean of the College of Arts and Sciences at Oakland University. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And Step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
You're listening to the Oakland County Megacast on Civic Center TV, 89.3 Lakes FM, 88.1 The Biff, and Birmingham Area Municipal Access. More interesting interviews coming up in just a couple of minutes.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Megacast. I'm Ronnie Dell in my home studios, reconnected once again. Tyler, I want to say thank you for taking the reins. Technology is great when it works, but it's frustrating when it doesn't.
Yeah, that's for sure. And, it's just been something that kind of rolls downhill until it comes to a complete stop. Hopefully we're at a complete stop. I'll knock on this fake wooden desk, this other fake wooden desk that's below me over here, and hope that everything goes well from here.
What a way to start off a Monday and also a new month. But while we are struggling with a few technical issues, there are still a lot of great things and exciting things happening over at Oakland University, even in the middle of the pandemic. Joining us now on the Megacast is Kevin Corcoran. He's the Dean of the College of Arts and Sciences and Chief Community Engagement Officer. Great to have you with us here, Kevin.
It's terrific to be here, and I'm glad everything's working.
We always get the show on one way or another.
Terrific. Yes.
If anything, COVID-19 and the pandemic has taught all of us to not stress out and to pivot and take life as it goes, right?
And be generous and compassionate.
Most definitely. And you have some exciting news and some exciting things going on over at Oakland University. Do you want to share that news with our audience today?
We sure do. We are in the process of launching a new Center for Globalization and Culture that was made possible by the estate gift of an alum of ours, a fellow named Barry Klein. Now, I could just start off by telling you a little bit about Barry, who I never met, but I've heard fantastic stories about. Barry was one of our early alums from the 1960s. And Barry was a sociology major who went out to Haight-Ashbury in the late 60s and early 70s, wrote a book about his experiences, and his life journey took him to Florida, where he got involved in real estate. But he always valued his connection with Oakland University and always valued the education he got in the College of Arts and Sciences and Sociology. And so thought that was really important. He stayed connected, as so many of our alums do, with the university, and valued his connection, was involved with our alumni boards, mentored students. People talk about the fact that he helped them make decisions about their own careers. And so again, even as after he's passed away, his gift keeps on giving. His personality dynamic continues to make a difference in the lives of Oakland University and in our community.
And it really goes to speak about how important our college years are and how they can shape us. And they stick with us as well, because he had lived in Florida for a long time, right?
He sure did. But throughout that time, he stayed connected with Oakland University. And I think so many of the stories of our alums throughout the last 60 years plus are the same kinds of stories of, if not for Oakland University, I'm not sure I would have gone to college. And if not for Oakland University, my life and the life of my children and grandchildren are transformed from that experience. So that those 4 years that often we struggle through, we don't recognize sometimes what a difference they're going to make.
What a legacy, really, Oakland University in helping to shape the futures of so many students. So tell us about the center. When is it going to open, and really what is the goal of the center as well?
Sure. The nature of these kinds of gifts are they to get very detailed here, is they need to accumulate interest. And it's really the interest on the gift that allows us to do things so that that principle will never be touched. The specific gift. So we're planning on launching probably summer, fall of 22. It will focus, as its title suggests, on globalization and culture. And we're going to do something a little bit different. In some of the early conversations, Barry had the idea of an endowed chair, the traditional endowed chair. Somebody would come and be here for their entire career. We want this center to be front and center in the conversations about global and cultural events. And so we are going to have a visiting faculty member, a new one every year, who is going to focus on a topic of current interest and current events that we want to help our campus and our community be informed about and engage both the campus and community in discussions. So the gift will enable us to bring people from elsewhere in the United States and around the world, quite frankly, to our campus. It will allow some of our faculty to be freed up who are interested and who do scholarly work on the same topic. And as well, and this is a key part of Barry's gift, and like so many of our alums, they recognize the value to our students of that direct contact with faculty. So it's also going to be able to fund some of our students in working on projects of relevance to this topic. And Ronnie, if I could just give you an example of the kind of thing we're talking about. If you imagine an issue like climate change, you can approach that from any one of a number of different directions. You can look at it from a scientific perspective, but you can also look at it from an economic perspective. And how does that change culture? And how does that change where people live and where people want to live? And so you can imagine any one of the top kinds of topics that we envision, War and Peace being another one, being approached from a whole lot of different fields, whether it's economics or sociology or health. So it's going to be an exciting time for the entire community. That's our hope and that's our goal.
So when you're trying to come up with the center and the goal for the center, how much is his family involved in some of these decision-making process, and maybe some of the topics you cover as well?
That's a great question. We had just to put this in context, Barry Klein died January 18th of 2020. And we had the launch of the center on the first anniversary of his death. In the meantime, we had discussions with his attorney and with his widow, Linda Walsh Klein, about trying to understand what Barry's vision was, that it was really important to us to make sure that in a gift, we are honoring the wishes of the donor and the donor's family. And so Linda was very involved in the discussions and very involved in thinking through how we went forward, and our idea of having the Barry Klein name, the Barry Klein Center, and the Barry Klein Fellows be part of the conversation moving forward. So the short answer to your question is very involved.
There's so many things changing right now with the world, and you wonder what the world's going to look like coming out of this pandemic. Oakland University already has so many great programs, such as the Center for Civic Engagement. We have Professor Dulio on quite a bit. Will this interact with some of those other centers and programs that you have going on campus as well?
Yes, it absolutely will be. And if we use any one of a number of examples, the Center for Civic Engagement also reports to me. And if I just use one example of, it's probably a year and a half or 2 years ago that we had Lech Wałęsa on campus, right? And for many of us of a certain age, that is a humongous name, one of the most influential people of the 20th century. But Wałęsa's motivation was driven in part not only by politics, but by his own faith tradition. So we have a Center for Religious Understanding that would be a logical connection with that. We have a Center for Ethics that would be a logical connection with that. Public humanities, if you think about that Eastern European movement of the Wałęsa era, one of the leaders was a guy named Václav Havel, who was the president of the Czech Republic. He was a poet by training, and it's part of the way he engaged people. So as I said before, this idea of all of these issues are so multidimensional and so foundational to so many different fields that it's important, and part of our goal is to engage all of those constituent groups. Absolutely.
So with that, what do you want the students to know about this?
Well, we want the students to think those kinds of big thoughts that Barry Klein thought. Right? It is very important to us to keep going back to that touchstone of why was he so passionate about Oakland University, and why was he so passionate about this topic? And so we want the students to think big thoughts. We want them to think about the world beyond their academic major, the day in, day out challenges that we have. How many times, Ronnie, have we said to one another over the last month or two, when COVID is past. So let's think beyond our immediate circumstances, whether it's things like vaccines or whether it's things like these large issues, and think about that and what can I do with my skills, with my talent, with my background to make a difference.
And how do you think that we're going to come out of this, knowing the use of technology right now, because it is allowing us to open up to other worlds that maybe we didn't envision before?
Yeah, I think the flip side to the coin that you just presented to me is the how many people have said, I miss people. You know, there is only so much you can do with a two-dimensional person. The three dimensions, that third dimension. And so I think we're going to think about, rather than, for example, meetings, of course they have to be in person, which ones need to be in person and which ones won't. And it will cause us, I think, to take a step back. And actually, this would be a great globalization and culture topic, wouldn't it? To take a step back and say, when is there value to being in person, and when is it perfectly okay to be technologically connected with other people rather than personally?
Yeah, because we all know because of the crisis, it's those organic conversations, those spur of the moment conversations. And, you see someone in line and you just start talking, and that's not happening right now. So there is a lot of value to that.
We also like to talk about the meeting after the meeting where the real work gets done.
That is so true, because anyone who has ever had to attend any type of conference, everyone knows that is where you meet the people and the connections that can really, like you said, get the work done, right?
Yes, absolutely. Absolutely.
So with this, when you're talking to his family, what do they most want you to know about who Barry Klein was as a person?
I will tell you one quick anecdote that both his widow, Linda, talked about. She talked about when they met, and they met later in life. And they were each walking their dogs, and they started talking on the street. And she said, everyone that passed them knew Barry. And one of his friends at this event on January 18th said, when Barry walked into a room, the energy in the room changed. That is a powerful presence that we feel an obligation through this center to make sure sustains in Oakland County, at Oakland University, and in our region.
And what a blessing that he was so connected to OU, that he is giving back and this legacy to live on.
It is absolutely the case. We feel blessed.
So with that, where can people get some more information about Barry Klein and this gift that he's given to Oakland University?
If they go to oakland.edu, they will see on the homepage a picture, for better or worse, of me and a story about the center and about the gift and about some of the things I've talked to you about.
So before we let you go, do you want anything else you want to share with us about the work that's being done over at OU right now?
Yeah, we've been hard at work for the last 6.5, almost 7 years now with our friends in the Pontiac community. And I think the OU Pontiac Initiative and the Klein Center are good examples of Oakland University recognizing we don't simply exist to educate students, though that is our primary mission. We exist to try to be stewards and try to provide resources, to provide help, to provide information to our entire region and to engage with our entire region. We think that part of public higher education is about the public good, not just private gain.
I'm really fascinated watching Pontiac right now, because I'm hoping and I'm thinking it's on the verge of breaking out and becoming a great city again. It just seems like there's so much start and stop and start and stop, but we have a lot of great businesses going into the area, which I think can really reshape Pontiac.
And we're proud to work in a whole variety of areas, not only economic development, but pre-K through 16. You need to help those kids. In arts and culture to make it a thriving community that people want to live in and be part of. Civic engagement is another one. And we also work very closely with the nonprofits in the community to help bridge to that future that's ahead for Pontiac.
Well, let's hope that they succeed, because we need Pontiac to succeed for all of Oakland County to succeed as well.
Absolutely. Absolutely.
Well, it's been great having you on the show, and we appreciate you taking time out of your Monday to be with us.
I appreciate you hearing about the Klein Center. We're very excited.
Oh, it's so exciting. And when it's open and up and running, we'd love to come by and visit.
We'd love to have you.
Thank you.
Love to see you in person.
I know. See, it's those organic meetings, right? Two-dimensional just doesn't do it.
Exactly. Thank you.
Kevin Corcoran with us here on the Megacast. He's the Dean of the College of Arts and Sciences and Chief Community Engagement Officer at Oakland University. Thanks again for taking time to be with us.
Thank you.
We're going to take a quick break here on the Megacast. A lot to get to in the second hour.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID. The only way to beat COVID-19 is to face it.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal. We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together.
Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Megacast. I'm Ronnie Dahl, Tyler Keep, holding down things back at the studio in West Bloomfield, and he is our IT hero again today because, Tyler, it is Monday, and it's just one of those days, right?
Yeah, though it's one of those days. It's definitely one of those. It's just that ball keeps rolling down the hill.
So just to let everyone know, you are watching and listening to the Oakland County Megacast on Civic Center TV. You can always tune us in Monday through Friday, 10 a.m. to noon. You can also catch us on Birmingham area municipal access, channel 15 if you have Comcast, 99 on AT&T. You can also tune us into the radio, 89.3 Lakes FM and 88.1 FM The Biff. We want to say thank you today to the West Bloomfield School District for allowing us to also live stream today's edition of the Megacast on their Facebook page. And we will be speaking with Deanna Barash just a little bit. But in the meantime, we are going to see if we can get our next guest. We are having a few technical issues with him as well. But in the meantime, Tyler, today, of course, being a big day, it is the 1st of February. And of course, so many bars and restaurants are being allowed to reopen here in the state of Michigan to indoor dining. It's going to be a lot different, though, when you do go out to eat, because no more than 6 people at a table. It has to be table 6 feet apart, but also only 25% capacity. So, those outdoor dining, the igloos, as well as the garden sheds, they've become so popular. I anticipate, Tyler, those are going to be sticking around for the future as well.
Yeah, 25% capacity indoors is not nearly enough for indoor dining itself to be profitable for these businesses. Those that are trying to bring in some extra cash right now and have not been able to do outdoor dining in a way that brings people in because of the cold may opt to do 25% all indoors and leave that be, or not open at all. And others are definitely going to continue to ramp up their outdoor operations as well as inviting people back in. On top of that, one other thing with the reopening of of indoor dining at our local restaurants is there is a curfew in place for 10 p.m. as well.
Yeah, and patrons are also going to be asked to keep their mask on, except for the times that they are actually eating. So they want you to take your mask on, put it off, put your mask on, take it off. Some restaurants are still saying that 25% isn't going to be enough for them to be able to reopen. So we'll see how long this lasts. But hopefully, we're on the back end of this, as more and more people are starting to get vaccinated. We're going to go ahead and try to bring in our next guest, John Lyman. He is the fire and life safety educator over at the Rochester Hills Fire Department. John, great to have you with us.
Good morning, Ronnie.
So we're trying to see if we can actually get you with a Zoom. If not, or if we start to have a few slowdowns or drags, then we'll just go ahead and take your audio, okay?
That sounds good.
Well, Happy New Year to you.
Happy New Year to you.
How are things over at the Rochester Hills Fire Department?
We are a very busy department, but we're doing well, serving our residents.
So right now, are your calls up or down? Because I'm thinking so many more people are at home now. So that means they're using their appliances more, the dishwasher, the, laundry, things of that nature. Has that led to an increase in the calls for you and members of your team over there at the fire department?
Great question, Ronnie. Yeah, actually our call volume is down just a slight from previous years. When COVID started earlier in 2020, we definitely saw a reduction in calls. People were nervous about calling 911 and obviously going into the hospital. So with regards to people staying home, we were anticipating an increase in even fire calls because people would be home cooking more. Obviously, you were talking about dining out. I'm so excited about being able to go out and dine today. We were anticipating that. We put some social media information out to our residents through Facebook and through our website, and we didn't really see it. We did not see an influx in calls for fires with more people staying home.
That is good, because I will say, I feel like I'm running my dishwasher every single day now, whereas before it'd be once every few days, right?
Same back here, yeah.
And what about calls because of accidents? Because not as many people on the roads right now.
Yeah, I think we've definitely seen a decrease in automobile accidents because of that. Yeah, our freeway, M59 goes in the south end of the city, and we're not seeing nearly the accident calls that we used to.
See, so there is some benefits to COVID-19 and the pandemic. Have you been able to get the vaccine yet?
No, I have not got the vaccine yet. Many of our guys have. I have chosen not to at this point.
Have any of them had any side effects, or just pretty much what's been reported?
No side effects at all. That's put them out. What we're hearing through the media about the sore arm. That's about it.
So John Lyman with us here on the Megacast. He's the fire and life safety educator over at the Rochester Hills Fire Department. Recently, your fire department was one of 250 fire departments across the entire country that was picked up for a pilot program, which is the National Risk Assessment. What exactly is this?
Yeah, so community risk reduction is kind of the buzzword in the fire service right now. And what we're doing is we're creating an assessment of our city to identify risks and prioritizing those risks, and then creating some programs to work to minimize those risks. So we've been selected to be a part of the sidewalk dashboard. Honestly, I don't know too much about it quite yet, but I know they're going to take some of our data that we've gathered and some dispatch data, and they will put that together for us and help with mapping of risk and trying to get our community risk assessment solid for our residents.
So is this something like maybe to help track where accidents are happening? So, kind of taking another look at that area. Okay, if we have so many accidents here, then maybe we need to change the flow of the roadway or something of that nature. Is that kind of the gist?
Yes, it could be something like that. Definitely, yeah. We're looking at all different types of risk in our area, and the types of calls that we go on. And that's how we're identifying what risk is.
Yeah, I wonder what it's like for someone such as yourself with your training. When you go out, are you looking and you're like, that's wrong, that's not good, this could happen, that could happen? What's it like day by day for
Yes, absolutely. I mean, when I go out as the fire and life safety educator, so I'm putting smoke alarms in people's homes and checking batteries. But I will be honest with you, and I've done this my whole career, one of the first things I do is look at your stove. I want to know if there's anything on your stove that's combustible, anything that can burn.
Wow. So it completely changes how you live your life, right?
It does. Yeah, absolutely. Absolutely. And it bleeds off at home. I've trained my kids. We unplug our toaster. We unplug our coffee maker. That's just a way of life as a firefighter. Sure.
Wow. Talk a little bit more too about, you're the fire and life safety educator, as you just said. So what does that mean? Because I know a lot of firefighters and I know none of them that have this title.
Yeah. So my job, my biggest job, of course, with COVID, it slowed that down to nothing, basically almost, is I'm going into schools and talking with kids about fire safety, and we target certain grades, the younger grades. And I'm also in the senior homes and talking about the big call there is fall call. So people slip and fall, and we respond on those a lot. So my job is to try to educate those people, the kids, the adults, to be fire safe, to be fall safe. It's a very unique role here in Oakland County is my role.
So what are some of the things that we should be looking at? Other than our smoke detectors, we're all pretty much aware of that.
Yeah, you'd be surprised how many homes, what I found here in Rochester Hills, how many homes have older smoke alarms. And we are looking at swapping smoke alarms out every 10 years with 10-year batteries, or if you can get the electric ones, if you already have the electric wiring. But having proper smoke alarms, I'm installing one inside every bedroom, one outside the bedrooms in the hallways, one on the main floor, one in the basement. Very important to have working smoke alarms. They do save lives. Carbon monoxide alarms are also a big thing that I go in to make sure that people have those. We recommend one on every floor for a carbon monoxide alarm.
So with more people spending more time at home, and I worry about some of the kids that are left at home as well. Maybe, they have like a 11-year-old brother and, an 8-year-old, and the parents, they think, okay, they're old enough to be left at home. But if a fire starts, how important is that fire escape plan, but also for the kids?
Oh, yeah, a fire escape plan is essential in your home. And I talk about that with kids in schools. And when I go to the homes of our residents here for smoke alarms, I'll do a home safety survey, and we'll talk about all the different aspects in your house. And yeah, exit drills in your home are so important for young people to understand that there's two ways out of every room, the door and then a window. We talk about the escape ladders. And if you're on a second floor, considering an escape ladder. Very, very important that you practice that plan. I tell our kids in schools that you guys they do fire drills in the schools all the time. And so I say, when you're at home, do a fire drill at home.
Yeah, especially now with so many kids remote learning.
Yes. Yeah. And you figure all the time that extra time that they're there at home, find that time to carve out that time to do a fire drill in your home. I say try it in the dark, do it in the evening when it's dark outside, and turn out the lights and try to escape your home just by feeling your way.
It is the most heartbreaking thing. I have, as a reporter, covered so many tragic stories of people that have died in fires. And a lot of times they didn't have a smoke detector, or it was going off when they were cooking. So they took the battery out and just forgot to put it back in. And I know a couple years ago, there was the tragic story out of one of the Grosse Points where the two brothers passed away from after their house caught fire. And I think it could have been from the toaster. And it's important to have these plans, but also to do them so often that it becomes second nature.
Absolutely. Yeah. You want to know you want to know your house in the dark, because you may have to crawl through smoke. You want to know what door you're at when you're crawling through. Going down the stairs, think about going down the stairs and how you would travel downstairs in a smoke-filled environment. That's really important to think about. And then you've got the idea of basement fires. So we have some people that have rooms in the basement, and there are older homes that don't have those outdoor windows, the emergency egress windows that are now required by law for basements. It's so important that you know what to do. That main stairway, if that's your only egress out, if there's a fire in the basement, that could be a real problem getting out.
And John, I always get confused with the bedroom door. Is it leave it open at night or close it at night?
Yeah, great question. So we say close before you doze. So if you have a fire in your house, say in the kitchen, and your bedroom door is closed, that bedroom door will afford you time to escape. It'll keep the smoke and the heat out of your room and give you that time that you need to escape. Probably most likely through a window if you have a good sized fire. And statistically now they're showing that you only have a couple minutes to escape a fire, to where 30, 40 years ago, you had much more time to escape a fire with all of the plastics that are in everything in our home. It goes up, it creates a darker smoke. It's just not like it used to be, 30, 40 years ago.
That's good to know. And that's a good catch line as well. Close before you doze, because
I use it all the time.
Back before, I think it was the other way around, right?
I always tried to keep my bedroom doors closed anyway, even before the close before you doze. But that you definitely want to keep your bedroom doors closed now today.
Well, John, it's been great having you with us. I always learn so much when someone from the fire department comes on and talks with us. Before we let you go, anything maybe we didn't touch on that you want to share as well?
Yeah, I just want to say to Mayor Barnett and the City Council here in Rochester Hills, they have been so supportive in the initiatives that the chief has brought forward. And we are trying everything we can to keep our residents safe, keep our firefighters safe. And our mayor and our council are right on board with that. And so I just wanted to make sure that we said thank you to them.
Well, and I'm sure they appreciate everything that you and all of the team members do over there at the fire department. So thank you to all of you as well, and stay safe and stay healthy.
Thank you, Ronnie. We miss you on TV, by the way.
Well, thank you. See, now you just have to find me in a different way.
I know, that's right.
Well, you have a happy, enjoy dinner tonight. Are you going out?
I'm hoping to. I got to talk my wife into it, but yeah, I'm hoping to.
Well, have a nice time out, and thank you again for your time.
Thank you.
We're going to take a quick break here on the Megacast. When we come back, Deanna Barash with us. She's the Assistant Superintendent of Curriculum, Assessment, and Instruction over at the West Bloomfield School District. This is the Oakland County Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet Wear facial coverings when you leave your home and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Taking time out of your Monday to be with us here on the Oakland County Megacast. I'm Ronnie Dahl here in my home studios. Mr. Tyler Keefe holding things down for us there in West Bloomfield. As a quick reminder, you can always catch us on Civic Center TV, Birmingham area municipal access. Also tune us in channel 15 on Comcast, 99 on AT&T. And we want to say a thank you to the West Bloomfield School District for allowing us to live stream today's edition of the Megacast on their Facebook page. And with that, let's bring in Deanna Barash. She is the Assistant Superintendent of Curriculum Assessment and Instruction for the West Bloomfield School District. Always great having you on with us.
Yeah, thank you for having me again, Ronnie. It's good to see you.
You know, I know that we talk to you a lot, but the information changes quite frequently as well.
It does. I think I would like it to not change quite so frequently at this point in time. It's been a long year, but yes, there's always something new to talk about. So thanks for having me again.
I will say, I would think that the high school students, most of them were so excited to get back into the building. How's it going?
It was great. So we welcomed our high school students back for the first time since last March, last Thursday. And so they had 2 days back in person before we had the weekend. It went really, really well. I definitely want to give a lot of support and praise for our teachers and our administrators at the high school, and particularly our transportation department in the district, who are managing cohorts at every single level, midday runs, early morning runs, afternoon runs, and getting kids there safely every single day, multiple times a day. So we're excited to have the high school students back in the building.
Yeah, because it is confusing for people that are out and about, because we are used to those regular school hours. But I know that the Keiko Harbor Police Department, a lot of times an officer will sit outside Roosevelt, to help direct traffic or just to put the lights on so that people are aware, because the times, they're all screwed up right now. I'm always like, when do the kids come? When do they go? I don't know.
It makes the day go very quickly because there's always someone moving. And so I know that our principals definitely feel that. They just get kids in, they get settled, and then it's time for that first cohort students to leave. And then the next cohort arrives about 90 minutes later, and then get through and do the afternoon. So the day goes very, very quickly. So, and it is, we're still following what we've always done, which is really 4 tiers of busing. So North End, South End, middle school, high school. So buses run in our district all day long.
And it's important for the public to understand, just to be, extra careful with so many of the kids out, because nothing has been regular during this time. But with that, I know that the school of choice window is about to close. Do you want to fill us in on that?
Sure. So we've been a schools of choice, really kind of participant for a number of years here in West Bloomfield. So kindergarten through 2nd grade is just typical schools of choice. So it's a lottery. So families from outside the district who are interested in sending their students to West Bloomfield, the deadline is tomorrow to apply to be involved in the lottery. And then obviously we have STEAM, which is our Roosevelt campus, our middle school and high school. So students who are interested in participating in science, technology, engineering, arts, and math are able to apply for our STEAM program. There is an assessment. And so we gave our first round of assessments actually for kindergartners who want to come into the district on Saturday. We did it via Zoom, and it was great. They were so cute and they did so well. And then for our middle school and high schoolers, we did in-person assessments on Friday. So families who are interested in coming to West Bloomfield who do not live in the district, that deadline is tomorrow to apply.
What are you looking for when you do an assessment?
Well, obviously, we want students who really look like and demonstrate the same academic ability as the kids in our district. So we're looking for that. With our kindergartners, we're looking for readiness skills. We're looking for students who kind of have that aptitude for math and really can interact with their peers and are ready to come to school. So, and do a lot of collaboration and communication and some activities that would demonstrate that as well. And you might think that 4 and 5-year-olds via Zoom can't do that. They were so good, and they you could tell that everybody has been on Zoom, that there's really it's just the norm right now, because we assessed about right around 50 kindergartners, so not would-be kindergartners, 4 and 5-year-olds on Saturday, and they drew pictures and they did all kinds of stuff. It was awesome, and no issues at all with Zoom. So those are the sorts of things. For middle school and high school, we are looking for those students who demonstrate an aptitude in math and engineering and have an interest in the STEAM field.
So how many are you accepting?
We don't know yet at this point in time. So that's actually determined by the Board of Education. And so we will make a recommendation to them at Monday night's board meeting, February 8th. We haven't really determined that yet. We actually have a meeting scheduled for that Wednesday to look at our number of applicants, to look at the number of students, particularly for STEAM, who have met criteria, which means they've done well on the assessment, they've met our attendance kind of check, they've checked out as far as their behavior goes and suspensions and so forth. And then obviously for schools of choice K2, it's just based on enrollment numbers. So we'll have a recommendation that'll go to the board, and then ultimately the board will decide on Monday evening.
Well, because right now with COVID and so much remote learning, is enrollment down or is it up right now?
We're almost flat, actually. So we had anticipated a pretty significant decline in enrollment, and luckily in West Bloomfield, where other districts have experienced that, we have not. So we've actually had pretty much stable enrollment from last year to this year. I think the addition of Lakers Online, so the ability to have a fully remote option for families, has really been attractive and will be something that we're going to continue in the future, because we know that we've filled a need for some families as well. So I think flexibility is the key.
So I know my brother-in-law is a teacher in Macomb County, and one of the things they're actually doing is sending people to the homes of some of the students that maybe they haven't heard from in a while. Are you guys experiencing any of those problems, or no, because you're requiring attendance?
Well, we are, of course. I mean, I would think it's not widespread, and our principals have done an excellent job, and counselors identifying those students, reaching out to their families. If we're not getting a response, then we get our school liaison officer involved, who will do a home visit. I know some of our principals and social workers have gone out to do home visits, kind of wellness checks, just to make sure everything is okay. You know, it's making sure that we keep our students engaged and our families, and understand that even if you've chosen to remain remote, that you are expected. It is still compulsory education until you're 16, and so you're expected to be there every single day, even if that's remotely, and that it's not vacation. And so we continue to reach out to those families and provide resources, and really talk about, if it's not working in remote learning, then we probably should think about coming back to in-person. Because that tends to be a little more structured and maybe what that child needs.
It's so hard because every child is different and every home environment is different as well. So it can be challenging. But are you hoping that this is at least the start of getting back to some type of regular schedule?
Well, we hope so. I think, yeah, for sure, for a number of reasons. One, I think it's just so that we are seeing the light at the end of the tunnel. We've put so many safety precautions in place, and whether that's social distancing, that's our masks, that's making sure that we're cleaning on a regular basis in between cohorts and throughout the course of the day, that we are making sure our employees are screened every single day when they come in. We were fortunate to be able to offer a vaccine clinic for our employees on Friday, which was awesome, and giving flexibility when our employees do have appointments outside the district for their vaccines. So we've done everything that we can at this point to get our students back in person safely. I think it's just always that balance on what's that tipping point, to be able to make sure that we can keep kids in place, that we don't have to have this roller coaster of open, close, because our safety protocols have worked. We anticipate and are planning that, next year, our hope is that we get to come back, and that it is the new sense of normalcy. I think we'll probably, quite honestly, if crystal ball, this is just me speaking, we might still be wearing masks and doing some of those kind of precautionary things. But I think we anticipate coming back in the fall as normally as possible. I do think what we've learned, though, Ronnie, is that we need to be more flexible. And that flexibility for students, whether those are little people or middle schoolers or high schoolers, are really key. And that education now looks very different and can look very different than what it has for the last 100 years. So we really want to embrace the positive things that we've learned out of all of this and continue those, and then make sure that we're addressing the learning needs of all of our students.
Because, I've been watching some of the issues that are going on in Chicago right now with the teachers threatening to strike. And those are hard conversations, when there's not enough vaccine to go around. These are hard conversations for districts to have to face.
We have such a good working relationship with our unions, our teachers unions and our support staff unions, and we value the fact that before we make anything public, before we go before the board, before we do any of those things, that they've been at the table and part of those discussions. We survey our stakeholders, our parents, our staff, our students, about what's going well, about what they believe need to be those next steps and their level of comfort. And not saying that we meet the needs of every individual needs of every family every single time, or every individual staff member every time, but we can say confidently that when you involve those stakeholders in your decision making and your discussions, it goes much better. And everybody feels like they've been heard and that they have a voice. And we're going to continue to do that. It is tough. We are not seeing widespread vaccine coverage. And it seems to be rather haphazard whether some people are able to get appointments or not. And so we still have to continue to put those mitigation efforts in place so that we can keep kids and staff safe.
And then on top of that, the variant that is coming out, I know that Washtenaw County is experiencing it, the University of Michigan. How concerned are you and the leaders over at the West Bloomfield School District? How worried are you about the variant?
Well, I think worried because we're not sure what that means and what that could do to all of our plans and what we've been able to do by bringing students back in person. And so I think it is, again, where this push to go really fast and to return to normal, we understand, because it's something that we all want, and that school is one of those important places for students to be, and that for families to have that normalcy and to return to work as well. And the flip side of that is making sure that we aren't putting our students and staff at risk, and that we don't become a place where we're having to open and close if we have classrooms that have exposures or whole buildings that have exposure. One thing we notice about high school students is they don't socially distance off really well, right? So that is a real struggle to not congregate in the halls, to not have lunch, to not be able to stay after school and do clubs and activities in the same way that we have. But we really just need to continue to be very, very stringent about our expectations and about what is safe at this point in time, and kind of to tread lightly, because we aren't sure what these variants are going to be. And until we have vaccine coverage for everyone that wants it and that feels comfortable, and that we know that it works against the variants, I think we have to go slowly in order to get back to that sense of normalcy.
But one thing we did see with some of the high school athletes, they wanted to play so badly that they were really kind of policing themselves to say, we need to follow the rules because we want to be able to play. So do you think some of the high school students are going to be so excited to be back in the building, but also looking forward to those end of the year traditions that they want to be able to have? So maybe they are going to police themselves a little bit better so that they can hopefully have some of those traditions.
We hope so. I noticed, we didn't have any issues this last week and haven't had any K-8 with mask. That's not, everybody has their mask on. I think it's just become part of the norm at this point in time and the expectation. So students are wearing masks. They know that they need to stay away from each other when they're in the buildings and probably outside the building as well. And you're right about, if you look at our football team and our swimmers and certainly our volleyball team and our other outdoor sports, cross country and so forth in the fall, we were able to really hold sports normally, because our students were so vigilant and our staff were so vigilant about those safety precautions. We're in a holding pattern right now, of course, with winter sports. So they are practicing as best they can at this point in time. They're not having contact with one another, so they're not doing typical drills and those kinds of things. But I do think that the more they police themselves, and it's not necessarily, of course, as we know, what happens within school or within school activities, it's what goes on the weekends. And so, and when they're out with their friends and so forth. So I think we all just need to remember that we're excited that restaurants are opening. We're excited that there are other entertainment options out there besides staying home, but we still need to remember to follow those safety precautions so we can keep schools open and we can maybe bring back winter sports. And that we look towards the end of the year with prom and graduation and those really important end of the year activities. We need to make sure that we're able to do those safely and we don't have another outbreak.
Deanna Barash with us here. Anything that we didn't touch on that you want to share before we let you go?
We just are excited that we have everybody back K through 12 right now, pre-K through 26 actually in the West Bloomfield School District, and we will continue to partner with our community and with our parents and our staff as we move forward for the rest of the spring.
I will say for some of the students, they probably feel like they have new wardrobes because, they're putting the pajama pants away and actually getting out their jeans, right?
They were very cute when they came into school on Friday. It was truly the first day of school. They were excited. They were wide awake for that 7:45, which they've not been for quite some time. So we were happy to welcome them back.
Well, thanks again for all that you and all the members of the team are doing over there to try to make this possible as well. A lot of sleepless nights for all of you.
That's right. Yes, for sure. So thank you for having me again.
We're going to take a quick break here on the Megacast.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's going to be who?
And whether we wear green
or blue. But one thing we can all agree on to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Great to have you with us here on the Megacast. Just about 20 minutes left in the show, and we are going to be leaving you with quite the treat today. Our next guest is a self-made producer, a DJ, an art collector, but also a musical talent. With us now, Drummer B. Thank you for being with us here on the Megacast.
Yes, thank you for having me. Thank you so much.
So you're very well known in Detroit. Do you ever go by your real name?
Yeah, I go by Leonard, but most people just call me Drummer. Even my family members, everybody call me Drummer.
So tell us about your background. You do a little bit of everything.
Yes, people know me more from a hip hop background. I started with Big Proof. I've worked with By 10 from Slum Village. I've DJ'd around Detroit locally, open mic scene for about 4 or 5 years. I've also worked with Danny Brown, and I've worked with Transmad and Derek May, and yeah, I've kind of been around in a lot of different circles.
What's it been like for you during the pandemic? Because live music still has not restarted.
Yes, I know. Tell the truth, in the beginning, it was hard. It was a little depressing actually at first, because I'm a person that's used to DJing almost every week, maybe sometimes twice a week. And to not have any work, it was just kind of scary at first, not knowing where everything was going to go and just trying to stay safe. So I went through that time of it. Then there was also another part of it where it became a real creative time for me, because if it wasn't for COVID, I did 2 streams this year or last year. And those 2 streams helped me with, deciding how come about making my next project and what I want to do in the future. So like bringing more of a visual music thing to you, it wouldn't have happened if it wasn't for COVID.
And I have to say, really, you made headlines because of the concert that you did. Do you call it a concert? The performance that you did at the Belle Isle Aquarium. How did that even come about? It's fantastic.
Yeah. Well, originally, first, I would always go to the aquarium on the weekends. It's like a hidden gem. Surprisingly, a lot of people do not know about it. And I think it's just because it's only open on the weekends. It's part of the reason maybe, but I would go there on the weekends. And one day when I went, I said, it'd be a great idea to do an event here. And I was thinking if I could host it around movement, that'd be a great time because we have so many people from out of town. It'd be a good tourist attraction and it'd just be different, And one of the things that I ran into when I contacted the people about it, issues with the sound, with the fish and with lights and things like that. It could cause stress to the fish, from the frequencies of the bass to the lights flashing and all of that. So my idea became, maybe we could do a silent party. So we were going to do a silent disco with the headphones, 2 different DJs playing. You could still tour the aquarium, and we were going to have things on the lawn, activities. So once the COVID happened, took that all out. And after doing 2 streams that were very successful, I'm always trying to think of what can I do to take it to the next level. And I was like, you know what? Maybe I could stream from the aquarium. I was like, and I'm going to make all the music original just for the aquarium, like make it all a theme. I just wanted to do something different than the normal bedroom. Nothing against it, but I just wanted to bring something different to the table.
It's fantastic. And you named it the Age of Aquarius. What was it like for you to be able to perform in that setting?
Man, it was almost unbelievable. Just because I remember last year, it was just merely a thought, like an idea. So whenever something comes from a thought and it manifests, it's like an adrenaline rush, and it makes me want to make bigger goals and accomplish something else that's bigger than that. So I was very thankful. It was a rush for me. And to see how it was taken and perceived to the world was great. And to know that we were able to raise $1,000 for the aquarium, that was great. It was a good thing.
So you put Detroit on the map once again.
I guess so. I'm honored, Detroit born and raised. So, it's my job. I would consider myself a Detroit ambassador,
The one thing about live music, it's about the energy that you get off of the people around you. How do you try to capture that when you're missing the people?
Well, it's it works actually, because when I first started, you start from your bedroom and you go into a big crowd and you have to prep yourself for that, being nervous and, being around a bunch of people. So doing it from home is actually kind of easy. It's like nobody's around. It's like I'm literally just practicing to myself, and I can maybe even be a little more animated, but it's pretty cool. It's not as hard. It's actually easier for me.
So when the restrictions are eventually lifted for live venues, what do you think it's going to look like to be able to go to a live concert again?
Well, I know that people are like extremely excited about coming out to do anything. So I know once the doors open for that type of stuff, like it's going to be on, but there are going to be limitations. Only so many people will be able to fit in a certain spaces, and you're going to have to take safety precautions. But I feel like people are going to follow all of those things just because they want to come out. They want live music, like it's been a whole year. We've been missing it. So I think it's going to be a surge, honestly. Like it's going to be a lot of different things going on.
I will tell you, I'm there. I'm signing up. I mean, just look how excited we are to be able to walk into Starbucks again. It's like, come on.
The smallest things, yes, for real.
So do you think people are going to want to get the vaccine just so that they can start doing things such as going to events or sporting events, things of that nature?
Yeah, there's that big fight. It's people that's for it and it's people that's not. But then you have that middle part where you might not be able to work if you don't get the vaccine. You may not be able to travel if you don't get the vaccine. So it's like, it's kind of hard. I think to some degree, depending on your profession or what you're trying to do, you just might have to take it. But, I understand, being safe and everything, but that's going to be a hard area for sure.
Yeah, I think the vaccine and showing that you've had the vaccine or you're negative for COVID-19 is really going to be in our futures for all of us right now. I know that some of my friends, just to be able to go into, like if you're a salesperson, to go into, a business, you're having to show already that, you're not positive for COVID-19. But as someone who is also the performer, how worried are you about your safety?
Well, that's always a main concern, always. So I always ask those questions, at least since all of this has been happening. What are the safety measurements? Are people going to be masked? And I just want to make sure the promoters are going out their way to make sure that I'm safe, and as well as everybody else. So, as long as I can see that, then I feel comfortable. But I know, for even myself, I travel throughout the world, and I'm pretty sure it's going to be necessary to have that vaccine just to cross borders, and so.
So what's next? What's next for you? How do you top performing in the aquarium?
Well, I have some things in my sleeve. I'm not going to say the exactly what I'm gonna do because I like the element of surprise, but it's going to be just as big, if not bigger. I also have The Age of Aquarius, the actual album that I was promoting. That will be available February 12th via Bandcamp. You can go to my website, drummerb.com, to make pre-orders. And I also will have another record with Transmat in spring. So I have a few things coming.
But how do you get out to promote new music when you can't get out?
Well, it's really just taking advantage of this social media platform at this point, and I'm doing more things like this, Zooming interviews, and just being more. I was never like a big Instagram person or like super big on Facebook, but I have to engage more. I've been engaging more just so I can stay connected and build new fans and just finding new avenues of trying to get through this, because it will never be the same. So if you stay in the past mind with that type of mind and trying to go about it, you're just going to always be mad and frustrated. So like I said, I'm trying to take advantage of it, and like I did with the stream, I made a visual album, so I'm going to have to do the same with just trying to get the music out. Have to find a new way to get it out. Just be a little more sociable. That's all.
So what advice would you give to other up and coming artists?
I would say do whatever you feel. A lot of times you might have an idea, but you may be scared what your friends may think or associates, or maybe because the trend is so heavy in this area, you feel that your idea might be too left, when that's probably the thing that you need, you know? That's what makes you different. I encourage people to be personal with their music and, you know, how they present themselves, because the more personal you are, the more flavor, I guess, or soul your music or art, whatever you do, will have to it. Just make it kind of personal.
Yeah, you know, it's really been interesting to see how some of these social media platforms have launched careers for so many people. Although I will say, I'm like I'm old, because I'll see some of them and I'm like, who is that? You know, and, they're starting when they're like 12, 13, and 14 years old. I'm like, whoa.
Totally different. Like this, the internet is good. You know, we can use it in our favor. And like I said, COVID last year, it brought everyone to the same level in the music industry, just all the industries. So from the person that's in his bedroom to the person that was out touring all over the world, like we're all on the same platform right now. And it's really going to count on your talent. You're really communicating with people to get through. All the fluff, I feel like, is gone, like, because you have to break through.
So while you were at the aquarium, did you find a favorite fish at all?
My favorite actually are the piranhas. I mean, it's because they're so, like, they interact with everything that you do. Like, you go up to the tank and you get the wave in your hands, like they're all on you, they're everywhere. So I just like the piranhas. I like the way they move in the tank.
How long did it take you guys to set everything up and actually do the performance?
It was 2 hours. It took an hour to set up, and the actual performance was 40 minutes. And then time to break down. We were able to celebrate, do a cheers and everything. It went good, but you know, I planned it out that way. I planned it so we can go in, execute, do one take, not 2 or 3, and you know, be done with it.
Just another minute or two here with you on the Megacast. And being that you did grow up in Detroit, you are a Detroiter.
Right.
What are your thoughts on Detroit's comeback?
I'm all for it, actually. I'm all for a comeback. You know, we've seen a lot of eras, and the comeback was needed hard. So I'm happy for the comeback. I'm happy for all the new things that are in the city. It's a lot of new life in the city. I want to embrace it. And I also want the people, the new people and all the new things that are here to also embrace the things that were here, and to give and acknowledge those things, and not to like sweep it under the rug, because that will happen, you know, a whole new move of people, or, you know, technology and new buildings. People will forget about all of the original stuff and the architect that we had, or some of the historical schools. And Detroit has a lot of history. So we have to do better with preserving our history as we move forward in the future. So I'm all for that.
Yeah, it's been hard to watch some of the schools be torn down, because that's history. I mean, I'm from Ohio, and when I go back, my junior high is gone. It's vacant lot now. And it's like, you're missing something, right?
Yeah, no, for real. And a lot of those schools are in the neighborhoods. So when you go in the neighborhoods and you see that abandoned school, it kind of just hits you like, oh, like, yeah, it's crazy.
Well, it's been great having you on the show. You're very, like I said, extremely well known. You are a part of Detroit. Drummer, be with us here on the Megacast. Thank you again for taking time to be with us. We appreciate it.
Thank you for having me. I appreciate it.
Quickly, your Instagram, how can people follow you and get your music?
You can follow me on Instagram at drummerb313. And if you would like to get the music, you can go to my website at drummerb.com.
Great artwork, by the way. Who did that for you?
That was by Abu Haq. He is the original illustrator for the Drexcia Volume 1 comic book. And he has Volume 2 coming out later this year. And this is like a prequel to what's going on in the next issue. It would be like a guest appearance in that.
That's so cool. Is he local?
He's from Detroit. He's worldwide, and he's known for his art mainly for the Drexcia comic, Volume 1.
Oh, this was so great that you were able to collaborate and come together, but also thank you for also coming up with the creative way to promote the aquarium, because like you said, it's a gym here in our backyards.
Yes, I'm glad to be able to bring it to you guys, and it was well accepted.
That's great. Drummer B with us here on the Megacast. That's going to pretty much wrap it up for this rough Monday edition. Drummer B missed the top of the show. We've been all over the place. Internet connection issues, but you know, it happens.
Yeah.
So, but we will be back here tomorrow, 10 a.m. until noon. Thank you again for tuning in to the Megacast.